Dysfunction that we found is called neural therapy, which is a technique that was developed by a German physician. And we're injecting lidocaine and sodium bicarbonate into the problematic scars or the problematic muscle insertion area or the joint very superficially. So I'm going to treat this scar first. We've cleaned the skin. I have the needle bent. And I'm going to go parallel in, little poke. And I'm very, very superficial. The other benefits that patients report after these injections is it does help to improve their sensation. A lot of times after a scar, after a surgery, you'll have a lot of numbness in the area. And this technique can also diminish the appearance of the scar. So you see how it's expanding out the tissue there. And there's one tiny little part of the scar that we didn't get, so I'm going to do that part separate. And I'm just injecting as I pull the needle out. So one scar down, not too bad, right?
Well, not too bad.
Okay, so that one tested okay. This is number 2. A similar technique that we can do with lidocaine is if we have deeper scar tissue that's causing restrictions in the body or restrictions in range of motion or pain, we can do a technique called hydrodissection, where we're injecting lidocaine into the scar tissue to help the scar tissue to remodel, and it, over the course of a few injections, helps the tissue to return to its normal elasticity and helps with the pain. So you can see the needle goes to almost the end of that scar, and I'm injecting as I come out. Immediately after these injections, the patient's muscle strength will return to normal on testing. And this change may be temporary. It may take a few rounds of the injections for the change to be permanent. And so we can check somebody a week and a half after the initial injection. And if they're testing normal at that point, then we know that the problem has cleared and is not going to come back unless there's a new injury. Okay, one more scar up here. Okay, now we're going to clean the knee joint and do the knee joint. You kind of want to get right where the knee bends. And we're not going into the knee joint itself. We're just injecting small blibs of lidocaine all around the knee joint. And since we've already got some of the knee joint covered by the scars, we can use that to our advantage. We do maybe a ½ inch to an inch in between each of the little blibs. Our patient's being a great demo patient.
Trying so hard.
I even do these on myself, which can be a little difficult. Almost done.